The House Health Policy Committee will come to order. Would clerk please take attendance?
Chair Rogers.
Here.
Representatives Whitsett.
Here.
Carter.
Here.
Hosma. Neely.
Here.
Landville.
Here.
Coffia.
Here.
Conlon.
Here.
Farhat.
Here.
Fitzgerald.
Here.
Miller.
Here.
Reinkens. Vanderwall.
Present.
Filler. Mueller.
Here.
Van Workum.
Here.
Roth.
Here.
Schmaltz.
Here.
Thompson. Madam Chair, you have 13 members present, a quorum.
Thank you. Representative Conlon moves to approve the minutes from our meeting on June 27. Seeing no objection, the minutes are approved. Today we are hearing testimony on Senate Bill 280, which would eliminate the sunset and expand oral health screenings for children beginning in school, and Senate Bill 281 with regards to third-party network leasing and dental services. I appreciate members staying after session to meet, as my understanding is that SB 280 is time sensitive. First up, we will take up SB 280, and Representative Skaggs and Chris Young from Senator Singh's Chief of Staff will be speaking today. And welcome to Health Policy. Begin when you are ready.
Thank you, Chair Rogers, members of the committee, for taking up Senate Bill 280, a bill to eliminate the sunset on the existing kindergarten oral health assessment program and expand access to over 100,000 kids statewide. I got involved in this issue because Kent County has been a leader in early childhood health and development, and because Michigan has made incredible progress over the last few years in addressing oral health issues. The expansion of Healthy Kids Dental is impacting residents in every corner of the state. And I've been able to take visits and see how it's impacting kids directly. By aligning the kindergarten oral health assessment with the vision and hearing tests that have been in place for decades, we'll get even more younger children the desperately needed dental care that they deserve. Over the past few years, our state has done a great deal to improve educational outcomes. The most recent budget with more resources and access to food at school. This bill takes another step in supporting our children. Although fully preventable with good oral hygiene and access to dental care, cavities have caused over 50 million hours of missed classroom time annually nationwide. By passing this bill, we're going to continue to make great progress to improve oral health care and keep kids in school and keep them learning pain-free. I'm sure all members of the committee at one time or another have been distracted by a dental issue. We all know that kids can't learn without being distracted by terrible pain. So for the rest of the testimony, I want to hand it over to Chris Young, who's the Chief of Staff for Senator Singh.
Thank you, Representative Skaggs, for your partnership in this issue. Chairwoman Rogers, for allowing us to be here today in support of this very important issue. The kindergarten oral health program is incredibly successful statewide, and we're coming to remove that sunset in the bill and then also improve it by expanding it statewide, aligning with the vision and hearing programs that have been in place for decades, like Representative Skaggs noted. This is not a new issue. Was passed in December of 2020, but at that time they did have a sunset in it, and so that's why we come here today with a little bit of urgency to try and get this done. So welcome any questions, and I know we have some other folks, experts that can testify as well.
Are there any questions from members? Representative Carter and then Conlon.
Yes, thank you, Madam Chair. And I'd like to thank you both for your testimony. This is something that's been long needed in communities that are under-resourced. And when you do not have proper dental care when you're a child, you grow up to be adults that don't have proper dental care. This could lead to diabetes and other illnesses that will just affect the whole entire population. So by teaching good oral health in school will prevent diseases when you become adults. So I'd like to thank you both for bringing these bills forward.
Thank you, Representative Carter. We couldn't agree more that this gives us the opportunity to deal with existing problems, to teach healthy oral habits, and then to make sure that children and caregivers understands the resources that are available to them with the Healthy Kids Dental Plan, so that this is not just a one-time oral health assessment, but we believe that this gives the opportunity for children to have their entire childhood up to age 18 with good dental care.
Thank you. Representative Conlon.
Thank you, Madam Chairman. Thank you for bringing this to us, and this is really important that this is not allowed to be sunsetted. But can you tell us what you've seen so far since it's been, since 2020 when it went in place, and how it's helped our children?
Well, what we can say is that 60% of pre-K students do not see a dental healthcare professional. 60%. Almost half of children in Head Start programs have tooth decay, and close to 1/3 have untreated tooth decay. So there is a real problem that exists out there, and as a pilot program, this has been successful at bringing additional children into these programs to get better oral health, and we think that by eliminating the sunset, expanding it statewide, we can help kids throughout Michigan.
Any other questions? We'll have another opportunity after other testimony comes through. Thank you so much, Chris and Representative Skaggs, for your work on this important effort to ensure that our children enter school without undiscovered dental needs. To speak to the impact these screenings have on students, we will next hear from Casey Howard and Lisa Taylor from Smiles on Wheels. And please begin whenever you're ready.
Good afternoon, and thank you, Chair Rogers and committee members. My name is Lisa Taylor, and this is Casey, as you had mentioned, and we are here from Smiles on Wheels. We are a mobile dental hygiene program operating out of Jackson, but we service 150 schools throughout Michigan in the UP and in Lower. We have screened probably, I think, over the 16 years that we've been doing this, over 30,000 children. And we come across a lot of children that are not having their needs met. So we are here to speak in support of the Senate Bill 280, and we'd like to share some of our experiences as Smiles on Wheels, boots on the ground in the schools with you so you can see what we deal with every day. This is Casey.
Thank you, Lisa. Yes, I'm Casey Howard, registered dental hygienist, lead on the pilot program in Jackson County. So we were asked to partner with Jackson County Health Department. We were very excited to do so. So as Lisa said, we were boots on the ground kind of running. Thankfully, with our SEAL Michigan program already in place, we already had, a lot of protocols, different things that we could kind of take from to implement this. So we've worked very closely with MDHHS, with Michelle Quabi on this. She's taken a lot of points from us and vice versa. It is working very well. In Jackson County, we were able to screen about 1,700 children last school year. We are at a very high decay rate, unfortunately, in our county. Over 30% of our children, our kindergartners, have actual active decay. I believe our number was 37 urgent cases. Urgent is considered, active infection, pain, swelling. We'll get to some photos later. When you do see these photos in the slide presentation, which I think will also be shared, fully with you as well for later, those are actual cases. Those are, when I'm in the field working, actual photos of the children that I've seen this year. So our numbers have increased just slightly since we put this together, but 1,651 total assessments, 30% decay, and then 29% of that have been given referrals. So our number is up to 37 now. Next slide here kind of covers what we actually do. So this is a non-invasive assessment that we're doing. Fully disposable mask, follow CDC guidelines. We basically look, and there's some kind of bullet points that we take away from it to report back to the state. So next is kind of a chart. A lot of parents, general public, don't realize that baby teeth are not just baby teeth. They do a lot of different things for us. You know, they help us obviously with chewing, with function, speech, quality of speech. So if you have a child that has massive active decay, which again you will see later in the slides, I've had children with 3/4 of their mouth with major cavities on those teeth. So it does cause, you know, speech inconsistencies. So they're seeking therapy for that. If we had dental treatment, maybe it would be different. So that previous slide actually showed, nope, you're good, the dentition. So at 5 to 6 years of age, when we are screening these kindergartners, the teeth, molars, some of them are already in, they're going to have them until they're 12 to 13 years old. So basically anywhere from 5th to 7th grade, they need to keep these teeth. So if they are decayed, they are not going to, at 6, they are definitely not going to have them at 12 or 13. So, and then we get into things with appearance and things that we deal with as teenagers. So, yep, perfect. These are some of our actual active cases. So this is a child, you can see they have a front tooth in. So this is a 6.5-year-old in kindergarten. Major active decay. We can go to the next one. Same thing here. These are primary molars. These are the teeth that you're going to have, like I said, between 11 and 13. You can see the large areas of decay, active infection. Same here. Here. Yes, this is a tooth broke off to the gum line, so actually all that's retained is the root tip. The adult tooth is forming up in the bone underneath of the gum line, so when that adult tooth comes in, because there is such actual decay and infection, it could also impair the adult tooth that's coming in. So it also helps to hold the space for that adult tooth to come in as well. So these are just kind of some slides of one of my little cuties at a kindergarten roundup in East Jackson. But please, we're just asking for your support on this bill. It is so important for so many reasons. I came after 17 years in a clinical setting. This is going to be my 3rd school year with Smiles on Wheels doing public health, and it has been life-changing for me. So I have seen a lot. I saw with our Seal Michigan program a 2nd grader. I was out doing a cleaning assessment, fluoride treatment and sealants, and she opened her mouth. On the roof of her mouth, I could see didn't know what it was, to be honest, when she could see it when she talked. It was a golf ball size infection from a primary molar, the largest infection I've seen in almost 20 years of practicing, and it was in a 2nd grader. So had we maybe screened this child and provided her a dental home, resources for treatment, that probably would not have happened. So we see a lot when we're out practicing. There's a huge need in our state. So please, I'm just asking for your support on this bill.
Thank you. Do we have any additional questions from members? Representative Thompson and then Schmaltz.
Thank you. So when you mentioned a dental home, when you can give a referral to a dental home, I know that a lot of people, and especially in lower income communities, are struggling with access to pediatric dentists because even if they're cleaning and exams at a family dentist, these dentists do not want to perform treatment on pediatric children. So what kind of things can we do to encourage those locations? Or when you give a referral, who are you referring to and how can we get that information?
So primarily in Jackson County, we do have a strict referral system in place. I will personally reach out to the family, whatever dental office. So we go anywhere from, we're all over the state, as Lisa mentioned, but we have some great resources in Jackson. And if I call them and tell them I have an urgent case, 9 out of 10 times they're going to see that child within 48 hours for us. So it is very strict. We also follow up. So this isn't just I send a letter home and that's it. I'm actually following up. I follow up about 3 different times. At that point, if I just can't connect with the parent, can't put the resources in place, and I feel that there is a need that's maybe being not met by the parent, I'll actually reach out to CPS. They have a lot of different resources, so sometimes I'm reaching out basically just to connect that family with the resources. It's not because the parent's in trouble or I'm upset with them. It's literally to connect them, help them get state insurance. Sometimes it's a transportation issue. I can provide a bus pass. I can, provide an Uber ride. Sometimes personally we provide it ourselves. So there's a lot that goes into this program. I would say it's probably going to be dependent upon the individual health department. But again, ours is just the pilot program. But as this takes off and it becomes statewide, I'm sure there will be implementations put in place that will, and expectations for each health department to cover that. So there are a lot of resources that we connect them with. We also use MCDC, the Center for Family Health, a lot of other organizations as well that come into play with this outside of private practices.
Are you currently doing any work in Wayne County?
No, but we are not. We did the BSS, the Basic Screening Survey grant throughout Wayne County that was selected. But I do know that that it is on the list, and I believe they were going to be one of the health departments participating with it. So Wayne County has been at a lot of our outreach meetings where we've met collaboratively over the kindergarten oral health assessment. So
Thank you.
you're
Thank you
welcome.
for going above and beyond.
Oh, thank you.
Appreciate it.
Thank you.
Representative Schmaltz.
Thank you, Madam Chair. Yes, I just want to say you do tremendous work. We're very
Thank you.
fortunate to have you in Jackson County, and I've seen what you've done, and it's tremendous, and we do need it. And you've helped a lot of kids, and I don't think a lot of people realize sometimes a baby tooth can become the adult tooth, and if we don't take care of that tooth, that means no tooth for that
Absolutely.
person. So it's really important, and of course, taking care of the dental. Make sure that the whole body is healthy too. So
It
I
is.
really appreciate.
It's a oral health,
Right.
total body correlation, and that's hopefully what we're working towards as a state. So,
Right. And I really appreciate what you do in Jackson County. And
thank
yeah.
you. Thank you.
Thank you. Representative Carter.
Thank you, Madam Chair. And once again, I'd like to thank you for the work that you do. And I do not know whether or not you're in Oakland County, but I think I heard someone mention that your services can go to the Upper Peninsula. And that is critical because there are people in the Upper Peninsula who need these services as well. And I cannot stress to you enough how if a child learns to take care of their teeth, then they won't become an adult with heart disease, diabetes, and other chronic illnesses. So I applaud what you're doing and support what you're doing. Thank you.
Thank you.
Any other comments or questions? Otherwise, we will go on to reading in cards. So supporting the bill, not wishing to speak, is Kim Singh from My Community Dental Centers, and a representative and DIFS also supporting the bill. Supporting the bill is also Delta Dental, Michigan Oral Health Coalition, Michigan Association of Local Public Health, My Care Health Center, Michigan Council for Maternal and Child Health, Michigan Association of Health Plans, MDHHS, Blue Cross Blue Shield of Michigan, District Health Departments number 2 and number 4, Van Buren Cass District Health Department, Michigan Dental Hygienists Association, and United Way of Northwest Michigan. Thank you so much. Moving on, we will now hear testimony on Senate Bill 281. And again, Chris Young will be filling in for Senator Singh, and Nima Katabai with the Michigan Dental Association to speak on this bill. And begin when you're ready.
Thank you, Madam Chairwoman. Again, Chris Young on behalf of Senator Singh. I know he was hoping to be here, and I was hoping more so than he was that he was going to be here. Especially this issue is a little bit deeper and more of in a niche lane, and so I'm happy to be joined here by Nima that we've been working with on the Dental Association to sort of talk about Senate Bill 281, which adds transparency to the arcane world of dental network leasing. We've been working with MDA and many of the impacted stakeholders throughout this term so far this year to bring Michigan in line with the 27 other states that require transparency in the dental network leasing space. And I'll allow Nima to explain a little bit more about that, but I just want to thank everyone again for taking up this issue as well today.
Thank you, Chairwoman and members of the committee for the opportunity to speak on Senate Bill 281. My name is Nima Katabai, and I'm the Manager of Government and Insurance Affairs with the Michigan Dental Association. As Chris said, Senate Bill 281 focuses on the practice of dental network leasing to provide a little background. When a dentist is in network, so when you go to your dentist as an in-network provider, they've signed a contract with your insurer saying that they will be in network with your plan. What we've seen happen frequently over the past several years is that many of these networks will then lease their networks to other third parties, typically other plans, without informing the dentist. So what happens is patients will start arriving at the office saying that they're an in-network patient, and the provider has no knowledge or understanding of that plan. They've never agreed directly to that plan's policies, fees, or anything of the sort. So it can cause a lot of confusion when the patient arrives. And it can specifically causes problems because dental practices are small businesses. They're limited in staff. Oftentimes, the person who handles the billing and insurance is also your hygienist or assistant. They may be working reception. They may be doing other office manager tasks as well. So when they see a patient come in as out of network, it impacts the way that they bill the patient up front and the way that the financial side of the claim is handled. Keeping track of network leasing arrangements can also be very challenging. So once they start trying to put the pieces together, it can be very convoluted to figure out what network you're participating with, what network is paying the claim. And one of the key problems is that you can be in network with multiple insurers through a single contract. Dr. Miller, who's on the line, will be testifying about some examples that we've seen and heard from members and patients that have been impacted by dental network leasing. But ultimately, the goal of Senate Bill 281 is to create more, set standards for transparency and create some more options for providers so that they can make the choices for participation that are best for their patients, their practice. And specifically, Senate Bill 281 would require participation agreements to explicitly state that the network the dentist is joining can be leased. Allow a provider to opt out of the leasing portion of their contract without impacting the contract that they're considering for that specific plan. Require dental benefits companies to notify providers of all the third parties with access to the network at the time that the contract is signed, and then within 30 days of additional third parties being added, an additional notice needs to be provided. And then finally, requiring that any third party abide by the original contract signed. So making sure that the claims are processed the same way, the fees are paid at the same level that was agreed upon between the provider and the original contract. That's a high-level summary of the bill. I know that Dr. Miller has some more details, but I'm happy to answer any questions now or after his testimony as well. Thank you.
Thanks. Let's, in the interest of time, hear from Dr. Miller, and then we'll take questions at the end. Dr. Daniel Miller is a pediatric dentist who has experience with third-party network lease agreements that this legislation seeks to address. Welcome to Health Policy.
Thank you, Chairwoman Rogers and committee. Can you guys hear me okay?
Yes, we can.
Okay. Thank you for inviting me to testify in support of Senate Bill 281. And special thank you for allowing me to present virtually from my office so I could see my patients today. My name is Dr. Daniel Miller, and I'm a pediatric dentist who practices both out of Grand Rapids and Muskegon, Michigan. I work with a group that has 6 offices and around a dozen different doctors. I'm involved with the Michigan Dental Association at both a state and a local level, and I serve on the Michigan Dental Committee on Government and Insurance Affairs since 2021, currently serving as the vice chair. In my roles, both within the practice and the state association, I've had the opportunity to hear how dental network leasing has impacted both dentists and our patients. I've condensed those experiences down to 3 issues with real-life examples that our members are experiencing. The first issue is the most common issue, which is when a network is leased to a third party without proper notice being given to in-network providers. When this happens, the patients will be directed to the in-network provider, and the staff may bill the patient as out of network. This means the patient will pay out of pocket and expect to be reimbursed directly by the plan. However, since the patient is actually in network unknowingly to the dentist, the plan will remit an in-network payment to the dentist. At this point, the office has to spend hours to determine why the claim was processed as in-network, coordinate a refund of the out-of-pocket expenses, and then explain the situation to the patient. All of these steps take my team members away from addressing another dental patient's need, and this will harm the provider-patient relationship because the patients now start to blame the dental staff for these insurance issues. Senate Bill 281 will require more transparency and disclosures of these leasing practices that will help avoid this scenario, protecting the dentist-patient relationship which will also allow the patient to better maximize their benefits. That's the first issue. The second issue with network leasing can occur when a provider joins a network that is leased. Even though a provider may be in network, the third parties that are leased may take several weeks or months to update their systems so the provider can bill in network. This will require patients to pay out of pocket and be unable to maximize their benefits. This is a common issue when a temporary dentist is needed in the office. For example, the dentist has a medical issue or they're out on maternity leave and they need someone to fill in for a few weeks. In one case, in December 2022, a dentist took 12 weeks off for maternity leave. The dentist worked with the insurance company they have a signed contract with to coordinate benefits for this temporary dentist. However, the third parties that the network was leased to did not recognize this company's agreement or the temporary dentist for the entire duration of maternity leave, and they were unwilling to process claims as in-network, even though the original benefit company said they would. Those third parties also refused to honor the effective date of the signed contract, which meant all of the temporary dentist's work and all of their claims over those 12 weeks were processed as out of network. When this happens, the third parties took time to recognize the temporary dentist, and by the time they did, that dentist no longer practiced. The last claims in this case were reprocessed and reissued in July of 2023, which meant this issue took 7 months to resolve, which is not difficult just for the dentist, it's also difficult for the patient who is getting constant communication from the insurance company on these matters. Senate Bill 281 directly addresses this by requiring third parties to meet the original company's responsibilities in the original contract. The third and final issue that I'm going to highlight today with network leasing is addressing the need for third parties to meet the original company's responsibilities, I misspoke. We just did that one. The third one is going to be highlighting the importance of termination of the agreement and an effective timeline. Since the provider has only signed a contract with the original company, the expectation is when they terminate that agreement that all contracts are terminated. However, it will often take several weeks for the third parties to remove the provider from their network. In some rare circumstances, I've even heard members tell me they've been in network after canceling a contract for up to 6 months, which is not the way the contract is written. During that time, however weeks or months it is, the third parties payers will continue to process claims as in-network, even though the provider is no longer in-network. These issues are extremely challenging for the office to address because the third parties often will not reprocess the claims without hearing from the original insurance carrier. Beyond the challenges of getting in touch with the original carrier, it often requires mountains of paperwork and mountains of man hours that a small business cannot accommodate. Senate Bill 281 requires the third parties to honor the effective termination date, which will set clear guidelines for dental benefit companies to inform the third parties about changes to their network in a timely manner. These examples are real-life issues that both the dentists and patients are facing when it comes to network leasing. Senate Bill 281 will address these issues by requiring more transparency, disclosures, and options for both dentists and patients. I thank you for the opportunity to be able to present this complex issue and why it's important to dentistry. Unfortunately, I do need to return to some of my patients, so Nima is on site and well-versed in this topic, and he will be able to help answer some of these questions. But I thank you for your time and look forward to the continued working relationship of the Michigan Dental Association and the great state of Michigan. Thanks again.
Thank you so much for your testimony. Are there questions from members? Going once, going twice. Oh, Representative Reingans.
I kind of don't know how to ask this question because my head is still spinning trying to put my mind around what you're describing as the multiple complicated problems here that come from competing insurance, covering competing providers in a profit-driven system. So my question is going to be around how common this is in the dental space. Is this only dental insurance that this is a problem? Is this also medical insurance that covers dental? How common is network leasing for dental, and why are we also not talking about it for medical?
This, so this is a very common issue in the medical or the dental space. A lot of Michigan's dental insurance market is, there's a few big players, and then there's a lot of smaller players, and the network leasing mechanism allows a lot of the smaller plans into the state, which is how we see a lot of the network leasing issues come up. So we may see a dentist sign with a company that's has a significant market share, and then they may end up seeing a lot of these smaller plans. Being the Michigan Dental Association, we're really focused on the dental insurance leasing or dental insurance space. I think dental insurance operates very differently than medical insurance in a lot of ways. Especially since 2012, a lot of the Affordable Care Act requirements don't apply to dental insurance, and we do operate in some ways in a vacuum compared to the medical world. So that's why this is a very dental focused bill.
Representative Carter.
Thank you, Madam Chair, and thank you for your testimony. As one of my colleagues reminded me, this is an in-coil model that you're and now, yes, I supported it then, I support it now. But what I want to highlight is some comments that you made about how medical insurance and dental insurance don't often cover a patient's needs. I ran into one case where a person didn't have adequate dental insurance, but the medical insurance didn't cover it either. So I'm hoping, yeah, I see you nodding your head. So I'm hoping that this would help close that gap and make dental insurance overall, no matter who is covering it, more affordable for the patient. Thank you.
Thank you. Any other comments? All right. Thank you so much for all of your testimony. Again, thank you to committee members for meeting outside of our regularly scheduled date and time for these important time-sensitive bills. My intention is to hold a vote on both bills next week, so please reach out to Senator Singh or my office if you have suggestions or concerns before our scheduled meeting time next week. Minority Vice Chair Vanderwall moves to excuse Representative Filler. There being no objection, the motion prevailed by unanimous consent. There being no further business before the committee will stand adjourned.